Hello, National Minority Quality Forum. As the 121st President of the National Medical Association, I extend a heartfelt welcome to the 2020 Summit on Health Disparities and Health Brain Trust, democratizing data to build sustainable, healthy communities. I thank Dr. Puckrein, President and CEO of the National Minority Quality Forum, for allowing me to say a few words. Now, I want to reflect back on the emergence of COVID 19 as a global threat and how data concerning its impact on African American, Latinx, and American Indian populations were limited in the United States. In fact, I remember viewing the Centers for Disease Control website on March 28th, 2020, to learn more about the number and percentage of African Americans diagnosed with COVID 19. I subsequently sent an email to the CDC after my initial exploration was unsuccessful. It went something like this. Thanks for sharing the excellent data tables concerning COVID 19. When will the corresponding race ethnicity of persons diagnosed with COVID 19 be available? I'm particularly interested in the number of African American or blacks diagnosed with COVID 19. Now, on April 1st, I received the following reply. Good evening. We are interested on race data as well. However, we have a lot of missing data at this time. Once we have sufficient numbers, we will be sure to put out the information. Now, in the interim, I was so pleased to see that the Congressional Black Caucus Health Brain Trust, chaired by Congresswoman Robin Kelly, was demanding collection and reporting of race, ethnicity, and geographic data for persons diagnosed with COVID 19. Bravo! Similar diligence will be required to a certain equitable allocation of a safe and effective vaccine once it's developed. Your work is important. The National Medical Association supports and joins you. Keep up the great work.
Good morning. I'd like to thank the President of the National Medical Association for those very kind words. For those who don't know, I'm Gary Puckrein. I'm President of the National Minority Quality Forum. And I'd like to greet all of our attendees, welcome them back. Today is the final day of the 17th Health Braintrust and Minority Health Disparity Leadership Summit. So we're so excited of the presentations that went on, and I assure you that today will equally be a great day. I also want to thank our sponsors. Without their support, none of this could happen, and so a great thank you to them and all of the support they've given to the National Minority Quality Forum. As we get to the close of today's summit, I want to leave you with really two key ideas, two things that we should work on as we move into 2021. One is general, and the other is specific to healthcare. So on the general, you must vote. We cannot reimagine this healthcare system so that it provides quality care to all patients and individuals no matter race, creed, gender, age, unless we vote. Uh, we have to understand, in a democracy, uh, it's about the advocacy. It's about um, expressing and using your voice to set the tone for the country. And you have to recognize that there are those exercising their democratic rights who believe that healthcare is not a right, that uh, individuals can have access to the healthcare that they can afford. That's an opinion, and it becomes a force through elections. And so, um, for those in the African American community, we fought very hard over centuries for this franchise, and we have to use it. You have to drag that reluctant uncle and cousin and nephew and son and daughter who don't understand the importance of that franchise. You have to prevail upon them. They must vote. Not telling you how to vote, but we are telling you that the healthcare that you're going to receive is going to be associated with that vote. And so part of our agenda has to be coming out of this summit where we've had these great conversations about the need to reimagine this healthcare system, from clinical trials to access to care to new therapies, all of those uh, really important things that we need to change. It all begins with the franchise. And so I encourage everyone who is committed to healthcare, particularly the reimagining of our healthcare system, to understand that this franchise is invaluable in that contest. And it is the only way, really, to chart the future in healthcare. So that's my general. It's important. Um, what I hear every day is have a plan to vote early, but make sure at the end of the day you vote. Now to the specifics. So we at the National Minority Quality Forum, besides the summit, which has been really 17 years, I was reflecting on it earlier this morning as I was preparing to talk to you. It reminds me when I was a graduate student, my doctorate's actually in history, and I always enjoy working with physicians and nurses and all the allied health professionals because I learned so much from them every day. I, like many people, marvel at the language that they speak because it's completely foreign. They are indeed speaking a foreign language. They think they're not, but I can tell you it's a complete foreign language. But I love it because I learn from them and I grow every day. And they're wonderful teachers. But when I was a graduate student, John O. Franklin, he was sort of the dean of African American history back then. He was one of the early historians. There weren't a lot of well-represented and well-known African American historians, and John O. Franklin was one of them. And John O. Franklin, when you read his book, us young Turks would complain about it because essentially his book was a list of accomplishments. There was an African American carpenter in Pennsylvania in 1740, and there was a black writer who wrote in 1830. And us young Turks, we wanted to get a deeper understanding of the history and the trends, and not just list accomplishments, because we felt we are accomplished people. We don't need to explain that to everyone. And when we first started the summit, it was sort of like that, different, but what we spent a lot of time doing was enumerating health disparities to talk about the differences between Black and white outcomes and cardiovascular disease and kidney disease and asthma and all of that. So every summit was really just an enumeration of disparities. And we were pushed to say we have to get beyond the list. We have to really think about how we implement change. And what you see, if you've participated at all in the summit, is that now we're not talking about enumeration of disparities. We're talking about solutions. We're talking about people in community who are actually uh, about change, and they're using data. It's a data-driven change. We're showing how these differences are manifested in data, and the data tells us where we need to go to make those changes. Is it at the practice level? Is it in clinical trials? Is it legislative? Uh, that's what's profoundly important. That we've made a sea change, and I am so excited by all of the young people who have come up. This next generation, you're going to learn a lot about them in the 40 under 40 presentations, recognitions that we're going to have at lunchtime. But they're spectacular, and I'm so excited about them and the future that they portend for those in the African American community and for the country as well, because they're using science and data to bring about change, and that is really spectacular. So I'm optimistic. I realize, it's hard to be optimistic in this COVID moment. But inside this COVID moment is opportunity, right? Every challenge brings with it opportunity. And I think the opportunity is in front of us right now. The American healthcare system has to be reimagined. It is fundamentally broken. It That legacy system, and that's what we refer to it at the National Minority Quality Forum, was born in a period when inequalities in this country were acceptable. We had a segregated society which recognized that some people did not get a fair share. And it was codified, it was part of practice, both legally and socially. And healthcare was not outside of that. And we have not fully cleaned up healthcare so that it is focused on providing optimal care for every individual who comes through the front door of a hospital or a clinic or a pharmacy or a physician's office. And so the moment of change is here for us to do that. And I'm really excited by the opportunity. So I encourage each of you to take advantage and join in the conversation today. And then what I would say is once this is over, the work begins, and it begins with the vote. So I want to thank everyone for their participation, and I look forward to continuing to collaborate with you. Thank you so much.